This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles, answering a frequently asked question by patients undergoing breast augmentation. The good news is the recovery is pretty easy. Most patients are able to return to work within 1 to 2 days following surgery and full activity and exercise within 2 to 3 weeks. Well, the first part of the answer is that the swelling peaks typically about 36 to 48 hours following surgery. It then continues to subside as the months go by. By the time patients reach about 6 to 8 weeks, I would say 80% of the swelling is done, but it probably takes a good 6 months for 100% of the swelling to disappear following breast augmentation. Typically, I recommend that they stay on their back for the first week following surgery. After that, I think it's just fine for them to sleep on their side. I prefer that they not sleep on their stomach for at least 2 weeks following breast augmentation surgery. Well, the first important rule is to use common sense. Don't do too much of anything. It's possible to go to the gym within days of the breast augmentation surgery, but I recommend that they avoid working the chest muscles, of course, because that's where the surgery was. They can do a reasonable amount of leg exercises, even focus on the triceps or biceps muscles, but avoid the shoulders and chest muscles. As far as cardiovascular exercise, such as running on a treadmill or cycling, I recommend that they wait a few more weeks. I believe that flushing that you get after a vigorous workout will cause swelling to be accentuated following the breast surgery, and I typically want that to resolve as quickly as possible. So I recommend concentrated, reasonable weight exercises, avoiding the muscles that are directly involved with the breast augmentation. That's a great question, and the answer varies quite a bit. It's really important to see a qualified board-certified plastic surgeon to get the best advice. But essentially, the nipple position is key. If the nipples are pointing downward or the entire breast has descended below the crease beneath the breast, it's highly likely that the patient is going to need a lift. If the breast is slightly droopy, but the nipples are still up, in some cases, an implant that lifts that breast tissue and takes up that extra space that, for instance, might occur if a breast is somewhat deflated after breastfeeding. The breast augmentation alone may be an adequate solution. If the patient's breasts are already fairly large but droopy, of course, we wouldn't want to make the breasts bigger with an implant, and a breast lift would be their best option. The most important rule is that you don't have to massage following breast augmentation surgery. I don't believe there's compelling evidence to show that it's necessary for patients to achieve the optimal results. However, in patients who do want to massage the breasts, I recommend that they displace the implant slightly upwards, slightly to the side, and slightly medially in order to soften the pocket where the breast implant is sitting.